I recently overheard my front desk saying something to the patient she probably shouldn't have said while she was trying to collect deposit. I just did an exam on a patient. Patient's walking up to the front, and now the front desk, she's supposed to confirm their patient's next appointment and collect deposit that's going to go towards that appointment. But here's what she said to the patient. Hey, Nicole, your appointment is set up for 10 a.m. next Monday, but unfortunately, we do have an office policy of collecting deposit that's going to go towards your appointment for that day. And I heard this while I was working on a patient in the operatory, and immediately I wanted to stop. So I immediately brought this up as soon as the patient left. But instead of a confrontation, I always look at it as a way they can improve on what they're already good at. I started the conversation with her with something like this. Hey, Diba, I always tell you that you're good with communicating with patients and you always make them feel comfortable. But I do want to bring up something that we should all, as a team, should avoid saying to the patient when we're trying to collect deposit, whether it's you or the clinical assistant who's helping you out at the front. So what's really wrong with her saying unfortunately? When you start the conversation with the word unfortunately, it just sets up the wrong tone for what's to come next. Remember, patients don't mind paying deposits. They're already paying deposits for everything else besides dentistry, like going out at restaurants or making a reservation. But how you say things to patients does matter. So what this means is that by how she started the conversation, she must think we're actually doing something wrong in collecting deposit for an appointment. And I told her exactly this. And she didn't take it the wrong way because it wasn't a confrontation. It wasn't like, hey, you did something wrong. It was from this lens of, hey, let's all change something about how we're collecting deposits from patients so we can get them to keep their appointments.